When I talk to a typical patient about their problems for spine issues, one of the keys, I think, to good success is being able to communicate where we're all on the same page. And one of the most common problems I run into at first is, well, doctor, what's really wrong with me? I'm not sure that I understand. And I think it's important to try and take the time that's needed to really explain, well, here's what things look like. This is the basic anatomy or the basic problem that's going on. One way we'll do that at times is to either draw or show a model when patients have questions. And this is an example model of the spine. These are the hip bones right here. In fact, this is what your belt rides on. And then what's considered the low back or lumbar spine are the bottom, generally 5 bones and the disc in between them. The thoracic area right here, that's the 12 bones in those discs. And then you notice that the curve, which is called kyphosis, is different than the curve in the low back called lordosis. And when you get up to the neck, there's 7 bones in those discs that are associated with it, and the curve is again a lordosis, just like in the low back. Now, if you focus just a little bit closer with me, I'll just show the low back, but they're all essentially the same. These are the bones in the back, and in between right here, those are the discs. They are, generally speaking, really stiff shock absorbers or springs, and they don't have a lot of motion. They really don't. Their purpose, for the most part, is to give a nice gentle cushion. So every time that you take a step, you twist, you turn, and so forth. These give just a little bit of cushion all the way up and down from your head, all the way down to your pelvic bone. So you have what is essentially a curve or spring this direction, and you have a cushion in your disc. If you can notice this segment right here, there is a bone above, there's a bone below, and there's a disc right here in the middle. Again, essentially a shock absorber of sorts. But that disc has a little bit of movement. And that's normal. You're supposed to have a little bit of movement. Now, if you think though, if that disc is moving essentially excessively, then it's going to wear out. And that can be a problem for a disc, and it is one of the conditions that we treat. Looking on the inside, where I've sliced and taken half of the spine away, you see here the bone has all sorts of little perforations, and that's normal. That's the cancellous or softer bone in the middle of the hard outer bone. And the disc itself has layers. In the very middle, it's very spongy. And it gets progressively harder towards the outside. It's called the annulus. And that's the covering around the disc that when you load the bones, when you stand up, when you bend, when you use your back, that soft jelly is the shock absorber, and the annulus around it keeps that soft jelly material from squirting out in the wrong place. So it's really a balance. I mean, your back almost sort of floats along. And in the normal situation, most of us don't even know we've got a back. That floating situation is important for us. But excess motion, too much motion, can wind up degenerating or wearing out a disc, and with limited blood supply, we have a limited ability to heal that area. So we're provided with some natural safety mechanisms or check reins, so to speak, to prevent from essentially doing this. Obviously that doesn't happen, but why not? Well, you've got the annulus around the disc. That prevents things. These little bones that stick out in the back, in fact, if you feel up and down your back under the skin, you may feel these little bony points. They're connected together with a ligament, and its purpose is so that when you bend over, it doesn't allow you to bend too much. And that is shown in this particular model, this white. It connects this bone here to this bone here, that ligament, so that when you bend over, you're allowed a little bit of motion, but not a lot. And it's fascinating when I talk with patients, and they say, well, you know, when I bend over and tie my shoe, they make an assumption that you do this. You don't do that. You actually bend mostly at your hips, not in your back. On the back side, there's another ligament right here that protects the nerves too, and connects the rest of the bone, called the lamina. Again, preventing excess motion is one of its functions. It's yellow, and it's called the yellow ligament. Ligamentum flavum, that's a fancy Greek word. We use that a lot in medicine, pretty fancy Greek words, but it means essentially yellow ligament. And then finally, there is one other joint that's important, and it's called the facet joint. And that is a little joint on either side of that disc segment. And we have those at every single level up and down. And what that does, if I can show you a little better model, it prevents too much rotation, translation, but it allows a little bit. And it's got a covering over that ligament. And that covering will look something like this. On one side, there's no covering, just to show you that there is a joint underneath. And on the other side, this is the covering that's normally there. And you notice the nerve innervation of this. It's a richly innervated area. You know, patients, for instance, that have whiplash, this is one of the main mechanisms where it gets injured and causes pain.